Hi, this is Anna Minkina. I'm with Healthcare Solutions team, and I'm being joined by Dorcia Hart, and we're going to talk a little bit about small businesses and some other information that's helpful to businesses. I've been with Healthcare Solutions for about 13 years, and I work with health insurance with small businesses, individuals, and I do Medicare as well. So I try to cover the gamut of health insurance to meet everybody's healthcare needs. Dorcia?
Oh, thank you. I am Dorcia Hart. I'm a retired pharmacist that doesn't believe in drugs. I help people that are pretty much, over 50, working in the business world. Um, I used to have, issues with health, and I found that going the holistic route, you can do a lot better and not have to take a lot of drugs. So I try to help people, get off prescription drugs and do a holistic approach.
Thank you. Jarcia, can I ask you some questions about, for instance, what's your ideal client that you work with?
Oh, yes. Um, because, I was in the health field and working in the hospital, and I started, went toward retirement age. I try to help people that are over 50, they're working in the business world. People, pretty much like myself, found themselves, getting close to retirement, and they want to feel good, and they don't want to be bogged down with a lot of health issues and taking a lot of medications like I had to at first.
No, I understand that perfectly. I'm in the same situation. I just don't want to take medication. I'd like to try the alternative route. So what
Right.
kind of problems are they having that you can help them with?
Well, when you're working, behind a computer all day, you can get carpal tunnel, pinched nerve in your neck, frozen shoulder, back problems, sciatic nerve. It's just that, constant moving up and down with your neck, looking at the computer, and then back and forth with your mouse. Your body starts to get a wear and tell on your body, by doing that repetitively for a long time. So I worked 35 years, in the hospital and behind a computer. After so many years, your body starts to,
Sure.
get these aches and pains. And when you go and look for help, all the doctors want to do is put you on medication and shots and stuff. And so that's where I found myself. And a lot of other people are finding the same thing. So I want to be able to help them work through that and not have to be on prescription drugs.
No, that's great. So what benefits can you offer those people with those kind of type of problems?
So, I found out that we're really basically just dehydrated. Okay. And so I do an assessment to find out exactly what your problem is. I'm not going to treat just your symptoms. We're going to try to find out what the root cause is. And so I do an assessment of whether you're dehydrated or, you have a lot of inflammation in your body. I also look at your nutrition aspect. What are you eating? When are you eating? What are you putting in your mouth?
Right.
Basically. And then I also look at movement. Are you getting any exercise? Are you sitting at the desk all day, or are you getting up every hour like you should, so that you can get movement through your body and get rid of the toxic waste that your body so desperately needs to do.
Are there
So
any
those are
other?
the three things I look at.
That's really good because, in fact, I have that same thing too. Because I'm in front of the computer so long that I have to remind myself. Sometimes I'll put an alarm on there to just to make sure that I get up, walk around, drink some more
Right. That's
water, get some movement in.
that's
So I
great.
truly understand that problem. Absolutely. So, are there any other products or benefits that you offer them for that? Like you said, you mentioned the
Yes.
water.
You're right. So the water, there's water that I found that actually helps your body heal itself. And so, because we're really just dehydrated, there's water is more hydrating than the other water that you find in the store. This water has three properties. It's alkaline, of course, and it's antioxidant, which fights the free radicals that's attacking your cells. And
Sure.
then it's also super absorbing. It's 80% more absorbed down into your cellular level than the regular bottled water. So if you have all those three ingredients, then your body can actually heal itself. It can get rid of the inflammation that's causing, swelling and pain, and get rid of the acid buildup. in your body that you need to get rid of. So that's some of the properties for the water.
Do you do any classes or anything like that too?
Yeah, I can do demos for people. I have a class, a workshop that I do every Friday where we talk about just basic health and just, letting people know, water is a basic need. Good water is a basic need. Nutrition is a basic need, and movement. You got to have all three for your body to actually heal itself. So yeah, I talk about that in my workshop. I also do private workshops and demos for people too. If they have a group like a church group or anything, I
Sure.
can come and talk also.
Are there people that like come to you too, like they want to change, like you said, the nutrition and they want to be on some kind of a diet and regulate that? Do they come to you for that as well?
Yes, yes. And so it depends on, what they're interested in. You can do intermittent fasting. I teach that. I do vegan because I'm vegan. So if you want to, learn how to cook vegan or just change your diet over to that, and it's not, really a diet. It's just a lifestyle change. So
Sure.
you want to make, an adjustment. So this is something that you have to make a decision that you're going to change for the rest of your life. It's not something you're
Sure.
going to do today and you're going to stop tomorrow, you
Right.
know.
Right.
And so then the last one is movement. You got to have movement in order for your body to um, get rid of the waste. So you have two fluids in your body. You have your blood that's pumped around by your heart,
Right.
and you have a clear liquid that's a lymphatic liquid that actually cleans your blood and gets rid of all the toxins. But if you don't move, you're just going to be stagnant. So that's why it's good to get up every hour. I also do a 1 minute exercise on Wednesdays, just to
That's
teach
great.
people to get up and do this 1 minute exercise. It's very invigorating, and you get your day started, jumpstart your day, and then every hour get up and do this 1 minute exercise. And it doesn't take that long.
Sure.
And if you're working, sometimes the businesses will like set an alarm for everybody to get up and do some type of exercise. That's
That's a
what we
great
used to do
idea. It really
we
is.
did that in the hospital. So it was fun,
Right.
and you get to see everybody because you're sitting in cubicles, you can't see anybody, and you stand up and you see everybody. So
That's
it
wonderful.
gets everybody more health conscious about, your body and what you should really be doing.
Right. No, that's wonderful. It really is. There's a lot of good benefits on that. So people want to know more about you and what you do. Can they contact you if we put the information in on Facebook on how to reach you? Is that the best way?
Yes, yes. I have a website, Dr. Hart's circleoflife.com. They can go there, or we can put something, associated with this meeting. We can
Sure.
put some links in there and people can go there and find out more information.
That'd be great. That
Yes.
sounds wonderful. I'm
Okay.
definitely interested in learning more about that.
Okay. Thank you.
Especially because I'm in that age group where you, like I said, the retiring age and looking forward and like I said, want to stay healthy and be able to travel as
Right.
much as
Yeah.
I
You
can.
don't want to be bogged down by a bunch of drugs. I mean, I've seen some people, they take a whole handful of drugs and that's their meal. It's like, it's not a way to live. So,
No, I
thank
totally agree with you. Unless you have
Right.
something really serious that you need to that, I totally agree. Make some
Right.
lifestyle changes. So it's good. Well, good.
So, so Anna, so you're into the group health insurance.
I am.
So let's hear about the health insurance. So I've heard about some things about group health insurance. How many people does it take to be a group? I'm thinking it's a large group, but is that true?
So a lot of people don't realize that, and a lot of small businesses have been ignored. Like yourself and I am, we're self-employed, but there's lots of small businesses, and they don't realize that only you need is like two people to form a group. It just can't be husband and wife, but you
Hmm.
could start with two people, and you could even have. I use the example. I had an attorney, and she had her admin working for her, so there was two people, but the admin had insurance with her husband. So she opted out so she could have a group of one. And they have a special time once a year. It's November 1st till December 15th, where for small businesses, they waive the eligibility thing where before it's got to be 70% participation, you have to pay at least 50% of the premium. during that one time of the year, the small businesses, it's a great time for small businesses to get their feet wet and start a small group plan. So
Oh,
that's
okay.
really
Yeah.
important.
Yeah, that sounds really wonderful because I think in the minds of businesses, they think it has to be a large group, like 20 or 30 or 100 people. But
Correct.
yeah, if you only need two people, then these small businesses can actually get insurance that will actually help their employees. That's
Correct.
exciting. Okay.
Absolutely.
So
Absolutely.
so what are some of the advantages of a group rather than an individual plan?
So like you said, one of the biggest advantages is, you're taking care of your employees, you're retaining employees and attracting new employees. Because
Mhm.
nowadays everybody's like, when you're getting hired, they're like, what benefits do you have? And especially healthcare, because the health insurance is expensive. So you can get a better plan through a group versus individual. So right now, the nationwide networks are only available through groups and not through the individual plans. So that's a big advantage there. And they have more options as far as deductibles and out of pockets and that, so they become a little bit more affordable. And the biggest thing too, for the business, it's a business expense. It's pre-tax dollars for the owner, and for the employees, their portion is pre-tax, where you can't do that with individual insurance. You can't pay pre-tax dollars, where you
Mm.
can do that when you're on a group plan. So that's
Okay.
an advantage of us too. So it's
Okay.
a lot
So
of
it's
great
so it's not
advantages.
more expensive then.
Right now, it's probably about a third less. It could change from year to year, but right now it's probably about a third less than the individual insurance. And like I said, gives you more options as far as plans, the nationwide networks. So a lot of advantages to starting with a group plan.
Oh, okay. So if someone doesn't know anything about pre-tax dollars, how can you explain that?
So when you get your paycheck, you get a gross paycheck and then they take out the taxes. So if it's pre-tax dollars, you're not getting hit for taxes and then getting it, taken out again. So pre-tax dollars is your gross, then they take out your insurance and then they take your tax dollars out. So in fact, it seems like it's cutting down what you're getting taxed on because it's pre-tax dollars.
Oh, okay. Okay.
So
All
that's a
right.
nice part of it. A lot of
Okay.
great advantages. Like I said, retaining and attracting employees, I think is number one for them.
Okay. All right. Well, that sounds really good. I think people should actually look into it because when you start the first of the year, you want to have everything ready for that next year.
Absolutely. And like I said, there's a special enrollment period. It's November 1st till December 15th. So like I said, small businesses can get their feet wet. All they have to do is, there's a census that I send out to them. They fill it out with the employee's name, date of birth, home zip code, and that's probably about it. Then I work with a number of insurance companies. So it
Mm.
depends on what state they're in because I'm licensed in a large number of states. So it depends on what insurance carriers work with that state for small businesses. Because, the
Oh,
large
okay.
ones, of course, they handle all of it, but there's probably only a handful that work with small businesses, like under 20 employees. I have under 10. I have a quick one. I had a small group and they were like I think they were like, they were started off with, they were like 12 and then they grew to, uh, 30, then 35, then 85 and over 100 because they had started off with that group health insurance.
Hmm.
So because they were offering benefits, people were attracted to benefits, and so they got more employees, and it's kind of a win-win. They make more profits, and more employees, and everybody's happy.
Right. Right. Yeah. I know a lot of people don't want to join a small business because they're thinking that they might not have insurance,
Correct,
and people want health insurance.
correct.
So what if you have employees coming to you and you hire employees after that time period, like mid-year?
So
Uh,
it depends. So there's eligibility. So when you start a group plan, you could put there like new employees are eligible. A lot of them use like the first of the month following 30 days of employment. So that way they get to see if employee is definitely staying. And then after 30 days, the first of the following month, then they're eligible to get insurance.
oh,
Or
okay.
every year there's called open enrollment. So let's say they started their insurance plan for the group August 1st. So every year in July, they have the opportunity to join the group plan as of August 1st. So,
Oh, okay, okay.
yeah,
But
you don't have,
they can
right,
get people in even in
mid-year.
that's not during that same time.
Sure,
Okay.
sure, sure. It's a
All
great
right.
area for them. So if they need
Okay.
any other information, the biggest thing is for them to, like you said, or even for myself, I can put some information in the contact. My email address is insurewithanna2, the number 2 at gmail.com, but we can put information in the chat as well, and happy to talk to one.
Okay.
Your consultant is free and there's no additional charge on the plans at all. Some people think, oh my God, you're going to charge me more. No, there's no charge on that. And like I said, I represent all the companies. So it makes,
Okay. Well, thank you, Anna. That was very informative.
well,
And
thank
I think
you.
a lot of people will enjoy trying to, understand it a little better and sign up and get that going.
Get some information and stay healthy with you as far as what that is concerned. I'm very interested in that. So
Right. Yeah, you stay healthy, then you won't have to use your insurance.
that's right.
Insurance
You have
is
to
just there.
have it, but you don't have to use it.
Right, right. It'll be there as a buffer.
That's right. Absolutely.
Yeah.
Well, great.
Okay. Well, it was nice talking to you, Anna.
Nice
And
talking to you. And thanks for everyone for listening in, and we'll put our information in on the Facebook page by our session that we just did. Thank
right.
you.
All right. Thank you.